You're welcome to PSY 322. Definition of clinical psychology. Introduction. In this lecture, following questions should be clear to the students. How clinical psychology is defined as an area of specialization in the field of psychology. Who a clinical psychologist is and the differences between clinical psychologists and other psychologists. How clinical psychologists function in their various departments. Objectives. At the end of this lecture, students will have been able, 1. to summarily discuss the clinical psychology field as an area of specialization in psychology. 2. To differentiate a clinical psychologist from other psychologists. 3. To itemize functions of a clinical psychologist. Content. Definitions of clinical psychology. Clinical psychology is a branch of psychology devoted to the study, diagnosis, and treatment of people with mental illness and other psychological disorders. In other words, clinical psychology is an area of specialization in the field of psychology that utilizes the theories and principles of psychology to help individuals live a stable and normal life. Clinical psychology is viewed as the application of knowledge and method from all substantive fields of psychology to the promotion and maintenance of mental and physical health of the individual. Clinical psychologists also explain the cause of illness, help in developing prevention, assessment, and treatment of all forms of mental and physical disorder in which psychological influences have direct, indirect, or main effect in contributing or can be used to relieve an individual's distress or dysfunctions. From all these perspectives, you can reliably infer that clinical psychology is relevant to the psychiatry and other medical specializations. In summary, clinical psychology is a branch of psychology responsible for the understanding and treating of psychopathology. High TQ. Which of the three statements best defines clinical psychology? ITA. A. Clinical psychology is a field of psychology and mental illness. B. Clinical psychology is a field that understands mental illnesses and other psychological disorders. C. Clinical psychology is a field of psychology primarily concerned with understanding and treating mental and psychological illnesses. The correct answer is C. If you pick A, you are wrong because clinical is not the only field of psychology or mental illness. If you pick B, you are wrong because though clinical psychology understands mental and psychological illnesses, but it does not move than that. While C is right because first, it is a field of psychology, then it is a field that understands and moves on to treat psychological and mental illness. In bracket, psychology, understanding of illness and treatment of illnesses. Differences between clinical psychologists and other psychologists. Clinical psychologists are different from other psychologists. What best distinguishes the clinical psychologist from his fellow psychologist? It is more a way of thinking. The clinical attitude that emphasizes on particular subject matters or techniques. Clinicians are concerned with understanding and helping individuals in psychological distress. In this pursuit, they engage directly with particular person in their actual life. Other psychologists. What best distinguishes the clinical psychologist from his fellow psychologist? It is more a way of thinking. The clinical attitude that emphasizes on particular subject matters or techniques. Clinicians are concerned with understanding and helping individuals in psychological distress. In this pursuit, they engage directly with particular person in their actual life functioning. In their natural life, situations they intervene in individual human lives. Respecting their complexity and uniqueness, clinical psychologists create theoretical methodological skills which involve clinical assessment and measurement tools. They are scientists trained in the method and procedures for conducting investigations. They are also professionals trained to provide direct services to clients. Clinical psychologists are health care professionals who work predominantly, though not exclusively, in the field of mental health. ITQ. You have in the board of an institution that requires employing a psychologist that will help in the helping of patients who are already at the end of life. Palliative care. The HOD of the unit now affirms that the main criteria needed for the job is a professional who understands patients individually and their complexities, and who would also be able to intervene in easing them to death. Who will be your ideal psychologist out of the following three? A. Developmental psychologist. B. Clinical psychologist. C. Social psychologist. ITA. If you pick A, you're wrong, because though developmental psychologists are people who understand how development from childhood to old age, they are not appropriate to intervene in easing psychopathology like illnesses causing deaths. If you pick B, you are right, because this is the difference between a clinical psychologist and other psychologists. If you pick C, you're wrong, because though social psychologists understand and explain our interactions with people in the society, they do not manipulate and intervene in our actual life functioning to assess and lessen distress. Main activities of clinical psychologists. 1. Psychological assessment. It involves the assessment of people through the use of psychological tests and principles to obtain a better understanding of psychological attributes and pathologies. Examples of psychological tests used include California Personalities Inventory, CPI, Minnesota Multiphasic Personality Inventory, MMPI-2, Eysenck Personality Questionnaire, EPQ, State Trait Anxiety Inventory, among others, STAI. 2. Psychological treatment. It is the use of psychological procedures to help others to lessen or remove distress and difficulties in functioning. There are many forms of psychological treatment, ranging from brief, practical procedures for overcoming specific fears to lengthy and complex treatment. Examples of psychological treatment procedures include cognitive behavioral therapy, psychoanalysis, just to mention a few. 3. psychological evaluation. It is the use of psychological principles to evaluate the effectiveness of treatment of other forms of intervention. Clinical psychologists have been involved in developing methods of evaluating psychotherapies as well as physical forms of therapy. The aforementioned are the main activities of clinical psychologists. However, there are also others, such as research, training of other professional staff, involvement in administration, health services, policies, and others. All these functions shall be explained extensively when discussing the roles of clinical psychologists in the subsequent lectures. Clinical approach in psychology. A psychological approach is clinical to the extent that it attempts to understand people in their natural complexity and in their continuous adaptive transformations. In the history of language, the term clinical evolved from ancient roots and changes its meaning with time, deriving from Greek word for bed. Its medical connotation was only later attached in medical usage. Clinical first described cases at the sickbed but later generalized to include any setting. Indeed, clinicians today treat ambulatory outpatients in contrast to hospitals where bedridden inpatients are to be found. But the constant core of meaning in medicine or psychology is on direct engagement with and concern for an individual. However, there are some concepts used to explain that as adjectives in expressions, such as clinical training, clinical intervention, and clinical science. The term is appropriately used to characterize the learning experiences, therapeutic activities, and requisite knowledge of the clinicians. Clinical judgment and clinical responsibility describe the thinking and values of the clinicians who may be required to take actions on behalf of his patients even if based on incomplete knowledge. In medical diagnosis, clinical tests are distinguished from laboratory tests depending on whether diagnosis depends primarily on direct observations and evaluations by the clinicians or whether laboratory procedures and technicians are involved. By contrast, in psychology, the term clinical assessment is used inclusively regardless of the procedures involved, provided that its aim is the understanding of the individual patient. Summary. In this lecture, we have understood that clinical psychology is a branch in the field of psychology that involves the use of psychological principles, procedures, and tests to assess, diagnose, and treat mental disorders. Major activities of clinical psychologists include psychological assessment, evaluation, and treatment. The clinical approach in psychology is the direct engagement with and concern for an individual patient. With this, we have come to the end of section 1. Thank you for listening.